Hi, good morning, good afternoon, good evening, everyone. I am Mehnaz Khairandish, Regional Advisor for Evidence and Data to Policy in the WHO Regional Office for Eastern Mediterranean based in Cairo. Welcome to our last workshop from our workshop series on GRADE methodology in 2023. And thank you for joining us. I can see, faces who have attended our previous workshops. So as you know, the aim of these workshops is to raise our knowledge and expertise in generation, appraisal, and use of evidence for policymaking. In our last two workshops, we explained GRADE methodology for appraising and using evidence for policymaking, and we discussed some of the relevant and common tools, such as evidence to decision framework. We discussed the guideline adaptation process and the methodology for adapting the recommendations from one setting to another setting in different contexts. And we also explain what the National Program for Guideline Development Adaptation means. And also we introduced the regional roadmap for establishment of the National Program for Guideline at country level. So in this workshop, our focus will be on the GRADE CERQual approach, which is an approach to assess the findings from qualitative evidence synthesis for informing decision-making and policy-making processes. So you know that, of course, systematic reviews of qualitative research are somehow increasingly used to bring together the findings from qualitative studies to be considered for policy-making. And it's very important to know how to assess and to appraise these findings, these results for policy making. So I can say that the main objectives for this workshop are to explore why and when it might be useful to include evidence from qualitative research for decision making in health system. And also we will discuss the GRADE CERQual approach for assessing the confidence in the evidence from this kind of qualitative research studies. And as I mentioned earlier, this workshop will be our last event for this year, of course, but we will continue with more trainings, capacity building workshops, and events on evidence-informed policymaking next year. And today, we will have several technical sessions as well as interactive discussions that will be delivered by my esteemed colleagues, Dr. Clay Glenton, Professor of Evidence-Based Practice at the Western Norway University of Applied Sciences, and also Dr. Simon Lowen, Professor of Health Management and Health Systems at the Norwegian University of Science and Technology. At the end of the session, we will also listen to the closing remarks that will be delivered by Dr. Arash Rashidian, who is Director of Science, Information and Dissemination in WHO Eastern Mediterranean region. And also I want to inform you that please use chat box for asking your questions, or for example, if you want to share your experience or your opinions or comments with us, please use chat box for that. My colleague Malika will check this chat box quickly and will inform us about your questions. And also, I want to mention that we will share some of our relevant sources to evidence-informed policymaking during the session on chat box. So I would like to encourage you to check the chat box, to download the files, or to copy the links for your use, for your reference later. Also, for today's session, there is a link that is shared in the chat box with Dr. Claire. which includes the sources of the presentations and all relevant materials to this session. So you can find our materials using that link. We'll also share another kind of document with you that includes all relevant kind of, I can say, documents, files, and materials to this session. Also, there will be kind of assessment form that will be shared later again on chat box, and we would be very grateful after this session to fill this form for us and send it to the EDP email, which will be shared by Malika with you again through chat box. So with all this, I wish you that you will you find this workshop and this session helpful, and I hope that you will enjoy this event. With all this, I would like to invite our speakers, Dr. Simon Lewin and Dr. Clay Glenton, for their presentation. Thank you so much, Dr. Simon and Clay, over to you. Thank you.
Thanks, Madaz. I'm just going to share my screen. Can you see my slides now?
Yeah, but yes, we can. I don't know that this is from my side or our colleagues. So this is if you again share it, because now it's not full. Yeah, that's great. No. Yes.
Great.
Thank you.
Perfect. Firstly, thanks, Manaz, and your colleagues at the Emirates Regional Office for inviting Claire and I to give this workshop. It's really a pleasure to have an opportunity to talk about using qualitative evidence in decision making, and also particularly how one might use the GRADE CERQual approach. And we're really looking forward to interacting with everybody over the next couple of hours. I'm just going to go through, if you like, some housekeeping issues. As Manaz said, the workshop has several objectives to explore why and when it might be useful to include evidence from qualitative research in healthcare decisions. We will introduce and discuss the GRADE CERQual approach for assessing how much confidence to place in evidence from systematic reviews of qualitative research. And you'll have a bit of time to apply the GRADE CERQual approach, or at least parts of it, in small groups today. So we'll be dividing you into small groups as we go through the 3-hour workshop. Just a few words on working together today. As Manaz mentioned, we really value your contributions, and please give everybody a chance to give their input. And of course, we need to be respectful of others' views. We'll have a coffee break at around 1:30 Cairo time for 10 minutes, just to grab something to drink and stretch our legs. And then if you'd like to ask a question or make a comment, you can either raise your hand, I think in Zoom, or write the question in the chat, or indicate in the chat that you'd like to talk, and we'll try and go through those questions as they come in. And of course, there's the evaluation form that Manaz mentioned. We'd be really grateful if you could complete that after the workshop. So without further ado, I'm going to go into the first part for today. And in this first part, I'll be talking about the roles that qualitative evidence synthesis can play in evidence-informed decision-making. And I'll also very briefly talk about the different stages of a qualitative evidence synthesis. So firstly, what is the aim of qualitative research? I'm sure many of you are familiar with qualitative research methods. They're generally used to describe the social world, the world around us. We use them to understand people's views and experiences of living with an illness, of healthcare services, and so on. And in many cases, we can use qualitative research to explain the social world by developing hypotheses, theories, or models. So for example, there are many models about why people do or don't adhere to treatment, and much of that draws on qualitative research. These are some of the common methods that are used in qualitative research: focus groups, different kinds of interviews, observation and document analysis. And qualitative studies may use one or more of these methods to collect data. And systematic reviews of qualitative research identify and synthesize these types of studies and draw the findings of those studies together, as I'll be saying a little bit more about in a couple of minutes. So how do qualitative evidence syntheses or systematic reviews of qualitative studies differ from reviews of effectiveness? Well, essentially, the structure is very similar. We start off by carrying out systematic searches for relevant qualitative studies. We assess the quality of these studies and extract data from them. And then we synthesize that data. So that structure is very similar to, those of you who do other kinds of reviews will be very familiar with this. But we follow the principles that are appropriate for qualitative research. So the analysis and so on is adapted for that purpose. And I'll say a little bit more about that also in a minute. So when we look at the world of evidence-informed decision-making, where does qualitative evidence fit in and the results of these qualitative evidence syntheses that I mentioned? So as you'll be aware, one of the key issues that decision makers are interested in, and this is something that's really become, I would say, routine practice in most settings now, is they're interested in, is this intervention effective? Does it have any important side effects or adverse effects? And of course, most decision makers are interested in the resource use, how much does it cost, and is it cost effective? But decision makers also have many other questions related to when they're making a decision. They may be interested in which outcomes matter to people. We know that patients, healthcare providers, managers may value outcomes in different ways. Patients may value the impact on their quality of life or their waiting time at a health facility. Healthcare workers may value a different set of outcomes. We're interested in, is this intervention acceptable to people? And this might include, is it acceptable to patients or health service users, but also to healthcare professionals and managers? Can we actually implement it? Even if the intervention is relatively effective, is it possible to implement it within our health system? And of course, what would be the impacts on equity and human rights? Is it likely that this kind of intervention would systematically advantage or disadvantage particular groups? And finally, how can we implement it? If we think it's acceptable and feasible and effective, how can we implement this within the health system? And for all of these areas that are shaded in green, we can use qualitative research or the findings from qualitative evidence syntheses to help understand and respond to those questions. Of course, before you even get to the stage of a decision, you might be interested in what questions and interventions matter to people. For example, people living with chronic diseases, or people have a particular other kind of health issue. And for that, we can also use qualitative research to better understand people's lived experience of an illness and which interventions matter to them, for example. So that was a very brief introduction to where qualitative evidence fits into decision-making processes. And now I'm going to also touch just for a couple of minutes on qualitative evidence synthesis methods. So as I mentioned, the stages of conducting a qualitative evidence synthesis is very similar to that of any other review. And you can see them on the screen now. So just to elaborate, of course, you start off by formulating the question. And many of you might be familiar with the PICO structure that we use for reviews of effectiveness, population, intervention, comparison, outcome. In qualitative evidence syntheses, we also have a kind of acronym of that kind, SPICE. And we use that, it's quite helpful. Many people use it to structure their question. And SPICE stands for the setting that we're interested in. It might be Egypt, or it might be the EMRA region, or the whole world. What populations or perspectives are we interested in? We might be interested in the views of people living with cervical cancer, for example. What is the topic of interest? Is it people's views? Is it about an illness? Is it the experience of health services? There may be a comparison, but not always, in qualitative evidence syntheses. And then evaluation. What is it that we're aiming to explore? There's several other sort of SPICE-like structures that can help you also to structure the question or formulate the question for a qualitative evidence synthesis. So just to give you an example of that, this is taken from a review, a Cochrane review on parents' views and experiences of communication about routine childhood vaccinations. So, of course, most health services are trying to encourage parents to bring their children for vaccination. So communication is an important part of vaccination programs. And this review was looking to explore parents' views of this kind of communication. Its setting was global. It looked at studies from all over the world. It focused on the parents and informal caregivers of children under 6. And the topic of interest was communication about routine childhood vaccination. And what it aimed to explore was views and experiences. So you can see the structure outlined there, quite helpful in unpacking that question. So we start off with formulating the question, and once we have that reasonably settled, like other reviews, we have to develop inclusion criteria. And that's where we would define in more detail the different settings, populations, and interventions, and also the types of qualitative study designs we might be interested in. For example, typically when we do a qualitative evidence synthesis, we're interested in studies that use qualitative methods of both analysis for both data collection and analysis, but you might have a looser entry criteria for areas where there's less qualitative research available. We may want to think about how far back in time we go. If there's an issue that's relatively new, like COVID, we may want to restrict the publication dates to cover the period of interest. And once we've defined the inclusion criteria, we would go on to search for studies. I'm not going to say a lot about this, but things that we would need to think about include which databases should we search. Some databases are richer in terms of the number of qualitative studies that they have. But we may also want to, if we, for example, interested in searching, if our question is focused on the EMRO region or the PAHO region, we may want to search databases that are specific for those regions. We need to think about, will we do things like citation searching, look at the papers that are cited, other papers that we've included in a review? Will we go through the reference lists of those reviews, and will we include unpublished studies that we know about that are relevant to the review question? So these are all important issues that you would have to think through. So then you end up with a set of studies and you go through them like in any other review to see which ones meet your inclusion criteria. And the one big difference here between qualitative evidence syntheses and systematic reviews of effects studies is that in a qualitative evidence synthesis, we're interested in variation in concepts rather than including every eligible study. And one of the reasons for this is that in qualitative data analysis, too much data can actually threaten the quality of the analysis. And those of you who've been involved in primary qualitative research may have experienced this. So for example, if you try and do 50 interviews and then you have sort of 50 transcripts of, 45-minute to an hour interviews, you end up with a massive amount of data. And because of the kinds of analysis methods that we use, that can actually be quite challenging to work through. So similarly in qualitative evidence synthesis, too much data can be a problem. And so where we have a question where there are many, many studies, so for example, if you were looking at people's views of what it's like to breastfeed, you'll probably find hundreds of studies of that, even within a regional search. We may use sampling to help us select those studies. So we develop a sampling framework. And we indeed did do this in the review of childhood vaccination that I mentioned. In that review, we were very interested in studies from low and middle income countries. So we included all studies that we found from those settings. And we also particularly were interested in studies that had rich data that would help us best answer our question. So we used a data richness scale to select the studies that had the richest data. And then after that, we selected a few more studies that were had objectives that were very close to our own review objective. So that's one way or one example of sampling, but of course people use different approaches and different reviews. The main thing is we want to bring the numbers of studies down to a manageable number. Like in reviews of effects, we need to critically appraise or assess the methodological limitations of the studies. One of the challenges in qualitative research is that we don't have consensus on which tool is best. So what's recommended at the moment is that you choose a tool that you're familiar with and that fits with the GRADE CERQual assessment. And we'll be talking about that a little bit more later in the session. And finally, we extract and synthesize the study data. There are many different qualitative evidence synthesis approaches. You may have recognized some of the names on the screen now. But essentially, those synthesis approaches sit on a spectrum. Some are more sort of aggregative in nature. I'll say a bit more about what that means, but they're more about describing everything we have. And others are more configurative, sort of trying to apply more interpretation to what we see coming out of the studies. Another way to look at that is more descriptive and more explanatory approaches. So by aggregative, I mean where the review authors are, in a sense, adding up the data from the primary studies to answer the review question. So they're putting together or describing each of the key elements that they're seeing in the primary studies. But in a configurative approach, we're trying to do more. We're trying to arrange the data or interpret the data from the primary studies to answer the review question. And in the final stage of the process, we would assess confidence, how much confidence we can have in each finding emerging from a synthesis. And this is really what we'll be talking about for the rest of the 3 hours today. We use the GRADE CERQual approach for that. It's the approach that's been recognized by the GRADE Working Group as suitable for qualitative evidence. And we'll say a lot more about that in the next few minutes. So I'm going to stop there just to see if there are any questions or comments. I see there are a few.
There's one in the chat.
Do you want to take that if you've seen it, Claire?
Yes, okay, so Mohammed Jalili, he has a question. Sampling the studies that meet eligibility criteria is a good idea and probably inevitable in the setting of too much data, but what measures can we take to minimize the risk of bias when performing the sampling, especially purposeful sampling? So, do you want to answer that?
Go ahead.
Yeah, so thanks, Mohammed. It's a very good question and something we definitely should be aware of. I think one sort of practical way is that we sample the studies without paying too much attention to the results. So an early sampling where we're primarily looking at the sort of descriptive elements of the study, so where they're from, who the participants are, etc., is the best way. It's challenging, particularly if you're also assessing the richness of the data. You will then inevitably be reading the results as well. So I think it's something we have to be aware of. But I think early sampling and high level of awareness, but it's certainly a legitimate concern and we need to be aware of it. I don't know if you have other comments to that, Simon. Or Arash as well, please jump in.
Maybe just to add there that what's also possible to do is you do your initial round of sampling, analyze the data, and then you end up with draft findings. And we may then, once we apply the GRADE CERQual approach, if we see that there are areas where, for example, we have very little data, or for a particular finding, the finding is based on studies which have important methodological limitations, we may go back to the bigger pool of studies and try and find some additional studies to plug those gaps. So it may actually be an iterative process, the sampling. So that is it is rather different from effectiveness reviews, and I guess we would approach bias in a different way, because we're interested in sort of conceptual variation in a qualitative evidence synthesis. We're not trying to generalize in a statistical way. We're trying to understand how people's experience of an issue varies across sort of settings or age groups, or various other parameters, so those are the kinds of things we try to ensure that we include in our set of sampled studies. So it's a different sort of way of approaching data.
And I can add one of the other things that we try to do in qualitative evidence synthesis, in fact, which I also think we should be doing in reviews of effectiveness, is we have what we call a reflexivity exercise. Those of you who are familiar with qualitative research will be aware of that term, where the review team at the very beginning sits down and has a discussion and reporting of what our perspectives are coming into the review, and to be aware of those perspectives. That sort of helps us in a way, not exactly police ourselves, but certainly raise awareness about the biases we have coming into the review. Obviously, it's not a perfect approach, but I think it helps raise awareness within the review team. No other questions in the chat.
Okay, great. So feel free to keep those questions coming, and we'll take them as they come in. And I think I'm going to hand over to Claire now for who will give us an introduction to the GRADE CERQual approach.
Right, let's see if I can share my screen. Does that look okay?
Yes.
Great.
Yes.
Okay. Thanks. So moving on to GRADE CERQual. So I'm going to start by giving a sort of broad understanding of the GRADE CERQual approach, and then we're going to break into groups, and we're going to go through the various components and have a couple of exercises for them. So I'll start out with a sort of overview of the whole system. But first, a little bit of background about why we developed GRADE CERQual, and Mehnaz and Simon have already touched upon these issues. So these types of reviews are becoming increasingly common, and they're increasingly being used in guideline or policy development processes and other decision-making processes. And obviously, if you're going to start bringing in new types of evidence into these kinds of processes, you also need a way of assessing how much confidence we should be placing in these kinds of findings. So exactly the same logic as for other types of evidence. We also know that if we don't make these judgments in a systematic and transparent way, the users are going to make them anyway. They're going to have some sort of implicit or explicit assumption about the confidence they should have in these findings. So this is a way of doing this in a way which is systematic and transparent. We developed it several years ago now. Started out with a group of researchers who had backgrounds in primary qualitative research, but also systematic reviews. And we carried out quite a lot of consultation with stakeholders, including decision makers who would be the end users of this product. And we tried to develop an approach that you could use on the sort of typical types of qualitative evidence syntheses. We wanted it to be easy to use. We wanted people to be able to report their judgments in a transparent way. And we wanted these judgments to be understood by end users, so by decision makers. So that was the aim. I hope we've at least achieved that to a certain extent. So simply put, the aim of GRADE CERQual is to transparently assess and describe how much confidence to place in findings from qualitative evidence syntheses. Now, we know that we have seen quite a few people using GRADE CERQual in ways which is not exactly as intended. So we thought we'd just sort of warn you what GRADE CERQual is not a tool for. So first of all, it's not a tool for assessing how well an individual qualitative study was conducted. So it's not a tool for assessing the quality of an individual study. It's also not a tool for assessing how well a systematic review of qualitative studies was conducted. So it's not a quality appraisal tool for either an individual study or a review. It's a tool for assessing the confidence in each of the findings. So what do we mean by confidence in the evidence? So we've defined it as the extent to which a review finding is a reasonable representation of the phenomenon of interest. So in other words, if we say that we have high confidence in the finding, what we're saying is that the phenomenon of interest that we're studying is unlikely to be substantially different from the research finding. As I said, we apply GRADE CERQual to individual synthesis findings. So those of you who are more familiar with reviews of effectiveness, it would be the same as applying GRADE to an individual outcome. So each review has several findings, and each finding has its own CERQual assessment. So what is a finding in the context of a qualitative evidence synthesis? So we've referred to that as an analytic output that describes a topic or phenomenon, or an aspect of a topic or phenomenon. And what that might look like in a review is a theme or a theory. People refer to, use a range of words when they're referring to these kinds of findings. It could be more descriptive, it could be more interpretive. But it would be very similar, and the words used here would be very similar to the terms used in primary research. It's part of the GRADE working group, the GRADE CERQual tool, and as we've said before, it shares the same aim as the GRADE tool that we use to assess the certainty of evidence of effectiveness. But as Simon mentioned, it is very much grounded in the principles of qualitative research. So it's got 4 components, and we'll go into these in a minute. There is a 5th component we're thinking about, which is dissemination bias or publication bias, which is also one of the components in GRADE for effectiveness. We haven't included that one yet because we just don't know enough at the moment about how publication bias or dissemination bias behaves in the context of qualitative research. But that's something that we're doing a bit of work on. And if anybody's interested in that topic, please let us know. It's something which does need quite a bit more work. So what kind of skills would you need to apply to GRADE CERQual? And these are the same skills that you'd need to do a qualitative evidence synthesis. You need an understanding of systematic review methodology, or somebody on the team does, and someone on the team needs an understanding of the principles of qualitative research. So I think it would be quite hard to apply GRADE CERQual without people on the team who have these particular skills. So we have a few slides where we're going through GRADE CERQual as a whole, and after that we'll discuss each one of them individually. So imagine a scenario where decision makers are considering offering pregnant women antenatal care in groups instead of individually. So they want women to start turning up for their appointments in groups. But before they make this change, they want to know whether women are likely to accept this type of group service. So they commission a qualitative evidence synthesis, and the synthesis has a number of findings, and we're just going to focus on one of the findings. One of the findings suggests that one of the aspects women like about these groups is that the other women offer them emotional, psychological, and practical support. So that's a positive finding, which suggests that this kind of group antenatal care might be accepted. So how much confidence should we place in that finding? Now, in an ideal world, what the studies, or what we would have found, were a range of studies, all very well carried out, all asking exactly the same question that we're interested in, and all showing together a very clear pattern. That's sort of the ideal scenario. That would also be the ideal scenario in any review, pretty much. However, what we know from experience is that in many cases, some of the studies are not well conducted. They've got various flaws in the way they've been designed or the way they've been conducted. And in that case, we might have concerns, and we would refer to that as concerns about methodological limitations. And if we feel that we have quite a lot of studies with serious methodological limitations, we might downgrade our confidence in the findings because they're based on studies with these kinds of concerns. So that's one element of the GRADE CERQual approach. So a second situation is where the studies might be very well done, but they haven't really asked exactly the same kind of question that we're interested in. For instance, some of the studies have not interviewed women about group antenatal care. They've asked their husbands, or they've asked the midwife or the healthcare worker how they feel about them, or how they think women feel about group antenatal care. So in this case, we might also have concerns, and we might think this is weakening our confidence in the review finding because of what we refer to as indirect relevance. So it's not completely relevant to the question. Another situation, which is also tied to the second component of relevance, is that we've asked all the right people. All of the studies have been asking women about group antenatal care. So all the studies are relevant. However, the studies are only covering part of the population we're interested in. Perhaps they're only looking at certain social groups, or the women are only from some geographical settings. And in that case, we might also have concerns that actually we're only getting a part of the picture. We only have what we refer to as partial relevance. And again, we might choose to downgrade our confidence in the finding because of this. So that was the second element, which is called relevance. So the third component is tied to the relationship between the finding, the overall finding, and the underlying data, and the extent to which there's a good match between what you presented in the finding and what the underlying data says. And if there's a good match, then that would be a coherence issue, that would be coherent. We'd be happy with that. However, in a number of findings, we find that the findings we've developed tend to focus on some of the broader issues, perhaps some of the larger studies. There might be nuances in the underlying data that we've sort of smoothed out. Why would we do that? We might do that because it does actually end up, we might develop a finding that's very useful, that's a bit broad, but it is very useful for the decision maker. But we might just want to sort of wave a little red flag and say to the end user, this is what we think is happening. However, there may be small nuances in the underlying data that we haven't completely captured. And in that case, we would refer to concerns about coherence. Similarly, we might have chosen to develop a hypothesis or a theory or a model, and we would do that because we think it would be useful for the decision maker. It might help push the field forward. It might help people understand something about connections. But again, we might be a little uneasy that we might have taken the data a little too far. We might just want to wave that little red flag again and say, we've come up with this model or this hypothesis, but it may be not completely reflecting the underlying data. So that's the third component of GRADE CERQual. And finally, the fourth component is referred to as adequacy. So in many reviews, you will find that actually you have very few studies. So a finding might be based on only 1 or 2 studies. And in that case, you might have concerns about data adequacy, despite the fact that the studies are well done, relevant, show the same thing. We are concerned that it is actually only based on 1 or 2 studies. Or in another scenario, we might have a lot of studies, but the data within the studies might be very thin. We might struggle to actually get a proper understanding of what's going on. And again, we would refer to that as an adequacy problem, but related specifically to the thinness of the data. And again, if we are too concerned, if we have concerns about that, we might downgrade our confidence in the finding. So those are the 4 components. And for each one of these, we would decide whether we had no or very minor concerns, minor concerns, moderate concerns, or serious concerns about each one of these components. And then we would put all that together and say that overall for this finding, we have high confidence, which means basically, yes, we have faith in this finding. We believe this is a reasonable representation of in this case, women's experiences of group antenatal care, all the way down to very low confidence, which basically means we are very unsure. We just don't know if this is a reasonable representation. Yes, we also have a tool for you. We can perhaps return to that, but we have developed a tool which helps use GRADE CERQual. Okay, so I'll stop there. I see that there is a question there. Could you, from Mohammed, could you elaborate on concerns of coherence by explanation in the last example you provided? I'm sure. Okay, so I'll go back to that, Mohammed. Yes, I think I can see why you ask questions about coherence, because I think the challenge with coherence is that for the other issues, it's not in your hands. You know, you can't decide how many studies you find. You can't decide what the quality of the studies are. You can't decide what the relevance of the studies are. But you can actually make a finding that is completely coherent. So you could create a finding where you simply describe everything that the underlying study said, every nuance, every piece of information. And there you would definitely not have any concerns about coherence. You would say that study 1 said this, study 2 said this, study 3 said this, for instance. And that would be fine. The problem with that is that you are not necessarily helping the decision maker, because you're not synthesizing, you're not making it clearer, you're not pointing to patterns, you're not making it shorter, if nothing else. So I think it's, in most cases, you would want to synthesize. The problem with synthesizing is that you do make some decisions, you do choose to focus on certain patterns that you're seeing. And in some cases, you might want to warn the end user that you might not have captured every single nuance. You might also decide that you think you see a pattern, which you think would be very useful for the end user, but you wouldn't, but you're not 100% sure. So you just want to sort of flag that to the end user, that this is what we think we're seeing, but we're not 100% sure. I'm not sure if that helps, Mohammed. See if I can see the chat.
Thank you very much. So as I understand, here is where the authors are actually intervening and they are introducing their own attitude and opinions, and this might actually sort of deviate from reality or whatever the results. I mean, that's the findings going through the filter of the authors, and this might be. All right. And how can we show that, or how can we find it when we are actually studying a synthesis study?
Yeah, so a good comparison. I don't know if you're more familiar with the reviews of effectiveness, but a good comparison is if you do a meta-analysis of randomized trials. You know that in some cases your point estimate might be hiding important heterogeneity, for instance, that there is variation in the studies that your point estimate is sort of covering up, if you see what I mean. It's a simplistic version of the nuances that you're seeing in the randomized trials. So it's similar here. You're making a sort of point estimate of your finding, but you might be hiding some nuances. And in some cases, you might want to draw the end user's attention to that. So for instance, here, you have 8 studies. It could be that 7 of the studies were pretty much saying the same thing, but the 8th one, you weren't quite sure what they were saying, or they were maybe not saying completely that they appreciated the other. It was a little more vague. They might be slightly more negative, and you've decided, you know what, that's not important. I'm just going to sort of go with the main patterns. Okay, so for instance, similarly to when you do a meta-analysis, you have to make a decision about, are the studies similar enough for a meta-analysis to make sense? And in some cases, for instance, on the slide, you see, there's 8 studies. Maybe 7 of the studies had women who were saying, very clearly, we like group antenatal care because we like talking to the women there, or talking to the other women and sharing experiences. But maybe the 8th study was a little bit more vague. We weren't completely sure that's what they were saying. Or maybe in some cases the women are saying one thing about group antenatal care and they're saying another thing about group antenatal care, but they are not specifically saying that there's a connection. But we are making the connection because we think that would be a helpful connection to make for the end user. And so we're making a connection because we think it's helpful, but we're sort of we're warning the reader that that is actually a connection we've made ourselves. So they might be saying we like group antenatal care, and then they might be saying, I don't know, it's hard to how could I explain this? But basically, we're sort of pushing the data, you know, in some cases, we're sort of pointing to connections that may not be 100%. Maybe 1 or 2 or 3 of the studies have clearly said that that's a connection, and the other studies have sort of given little bits of fragments of that argument, and we're putting it all together in one coherent argument. But we are making some assumptions. Does that make more sense? But yeah, but I mean, it's a good question, and it's perhaps the most challenging part of GRADE CERQual, because this is actually something that is in your own power, if you like. You know, you can make the finding more or less coherent, but sometimes making a finding coherent means you end up with a very long shopping list of every single nuance, which isn't necessarily particularly helpful. And it is sometimes helpful to push the data a little further to make a clearer pattern, but then warn the end user that that's what you've done. Okay, any other comments or questions? We will move on to Simon and the next part of the presentation.
Great. So before I go on to, in the next part, we're going to be going through each of the 4 components in a bit more detail. So hopefully if you have questions in your mind, you're thinking, well, what are we going on about? You might, it might become clearer over the next hour and a half. But before I do that, just to prepare for the group exercises, you should have received a worksheet from us, but we can also upload that in the chat. So maybe rather than asking if there's anyone who hasn't received that, I'm just going to upload that now in the chat so that everybody has it. So just bear with me for 1 minute while I do that. Yes, so it's in the chat now. So hopefully you can all download it from there. Manaz, is that visible on your side?
No, nothing is shared now.
Yes, we can see it.
You can?
Yes,
Okay,
yes.
Okay.
Okay, great. Super. So I'll just share my screen again for the next presentation. Let's go on to this. Okay, so hopefully you can see the slides. So in the next part, we're going to focus on the relevance component of GRADE CERQual. So we will try and sort of help you understand the role of this component in a GRADE CERQual assessment, and there'll be an opportunity to apply the component to a finding from a qualitative evidence synthesis. And as Claire mentioned, this is one of the 4 components that we assess when we're applying GRADE CERQual. So what do we mean by relevance? It's the extent to which the body of data from the primary studies that support a review finding is applicable to the context specified in a review question. So as I was saying earlier today, when you design your systematic review, you have a question that you're interested in, and that question has a context. And when I say context, I mean that in a very broad way. It includes the types of populations, the geographic context, perhaps a health service context. It might be particular socioeconomic groups and so on. And we're interested in the extent to which the body of data from the studies that we found are applicable to the context that we're interested in. So in order to understand that or to assess that, we need to compare the context of the studies supporting each review finding with the context specified in the review question. How different are they? And we need to decide whether any differences that we find are important enough that it may lead us to have important concerns that might ultimately lead us to downgrade our confidence in the finding. So Claire mentioned these different types of concerns we might have about relevance. The first is this idea of indirect relevance, where the studies underlying a review finding do not directly reflect our review question. So typical examples of that are, if we go back to the review on childhood vaccination, we might be interested in parents' views about communication around childhood vaccination. But in fact, most of the studies are focusing on other kinds of caregivers, grandmothers, aunties, and so on. And so we're a bit concerned that maybe this isn't really a direct reflection of what parents might be thinking and experiencing. And that would be an example of indirect relevance. Here's another example from back to antenatal care. We might be interested there in women's perceptions, but what we have is nurses' perceptions of women's experiences. And again, you might be thinking, well, to what extent are nurses' views of these women's experiences the same as the women's experiences? Partial relevance is the situation where the findings that we have, there's a good fit between the context of the studies and our review question, but we only have a subset of our sort of review question available. So we might be interested in studies from all over the world, but we only find studies that come from North America. And then again, we'd be thinking, well, there's something missing here. We can't be absolutely sure that the North American experience is similar to everybody else's experience. So that's quite a sort of gross example, but you can imagine that occurring in all sorts of other ways. We might, as Claire mentioned, have studies that mainly focus on people from higher socioeconomic groups, and we're not sure to what extent it applies to other kinds of people in low socioeconomic groups, and that would be partial relevance. And sometimes we just don't know, and this is because the studies haven't clearly described the aspects of context that we're interested in. So it might not be clear, for example, did all of these studies occur in primary care, if that's what we're interested in, or maybe some of them happened in hospital settings, and then, we have to just try and take that into account as well, where we have limited information, and so the situation is unclear. So if you remember, this was the, going back to the oil paintings, we have the situation where we have other people's views, the indirect relevance. We have the situation of partial relevance, people coming from only part of the settings or context we're interested in. So you can imagine that in order to assess this, we need to firstly look at the populations or interventions that the studies that we found. Are they different or only part of what we're looking for in the review question? And is this sufficiently important that it matters? Of course, there's going to be variation across the studies that we find, and we're interested in, is that sort of variation or what is missing likely to be important? We need to think about the setting and the place. Is the setting or place different from the one in the review question? Do we only have a subset of the settings we're interested in? And again, does that matter for this particular review finding? Sometimes the age of the study is important, and that could be important if you're interested in people's experiences during a pandemic period, studies that came before that, or in a period where there isn't a pandemic going on, would be obviously much less relevant. But this occurs in many other scenarios. So for example, drug regimens change over time. If you're interested in people's experiences of being on treatment for tuberculosis, we have a study from 20 years ago, we might think, well, the treatment regimes have changed quite a lot since then. Is this study still relevant to our question? So we have a look at all of those relevance issues, and then we have to categorize our concerns along the spectrum from either no or very minor concerns to serious concerns. So we have these 4 different levels of concerns, and that's the same for all the GRADE CERQual components. And when we make that assessment of whether we have minor or moderate concerns, for instance, we have to provide a justification. So we might say we have moderate concerns because the studies contributing to a finding were only partially relevant, as only a small number of geographic areas were represented. Right, so that was a little bit more about relevance, and now we're going to have a chance to apply it. So you'll have the worksheet, the worksheet that was uploaded in the chat a few minutes ago. It's an example focusing on fetal alcohol syndrome disorders. And this was actually, we took this example from an existing systematic review of qualitative studies, although we have adapted it slightly. So you can imagine that you're carrying out a qualitative evidence synthesis to explore parents and other informal caregivers' views and experiences of caring for children who are born with fetal alcohol spectrum disorders. And the review includes studies from any country that explore parents and other caregivers' experiences of raising a child with this condition. And this could include, of course, biological parents, but also other kinds of relatives, adoptive parents, foster parents, and so on. And the review includes studies that use qualitative methods for both data collection and analysis. And you find 11 eligible studies, and there are a number of findings, including people's struggles in getting a formal diagnosis, their emotional responses to receiving this diagnosis for the child, the impacts of living with that on the broader family, experiences of different kinds of respite care, and their concerns for the child's future, etc. But today we're just going to focus on one of the findings from the review, which says that parents and other caregivers experience a lack of understanding and knowledge about FASD among service providers, including healthcare providers, social workers, educators, and members of the police force. And this finding came from data from 6 of the included studies, and the remaining 5 studies didn't offer any data on this particular issue. So in a minute, I'm going to put you into breakout groups, I hope, online. And what we'd like you to do is firstly choose somebody to take a few notes. And then we'd like you to assess the extent to which the studies presented in Table 1 are applicable to the context specified in the review question. And if you have any concerns about this, please try and assess where they sit on that spectrum from none or very minor to serious. And you can note that down to feedback. Hope we'll have time for feedback from at least a couple of groups. So this is the information that you're looking for in that worksheet. Focus on this table, just the descriptive information, not the extracted data in the final column. We'll look at that for another part. When you're doing that, think about whether there's anything in the studies that raise concerns about their relevance. For example, the topic, is the intervention or healthcare condition different from the one we're interested in some way? What is the perspective? Do we have information about only a subset of our populations of interest? Where were the studies conducted? Is that relevant? And when were the studies conducted? Were they perhaps too long ago to be relevant? And remember that we're not looking for perfection. All studies have flaws, but we're looking for problems that might be sufficiently serious that they might undermine our confidence in this finding. Yes. So I just have to see if there's any questions in the chat. So Claire's answered those.
There weren't any.
Yeah, there weren't any further questions. Great. So I'm going to divide everybody up into groups now. So just bear with me for a moment while I do that. So 30, I think we'll do maybe 4 groups.
That sounds good.
Okay, so in a minute you should be receiving an invitation to a breakout room, and then you just have to click on that to enter the breakout room, and we'll call you back after a period of time. Okay, great. I think most people are back in the room now, so we'll just take some very brief feedback from maybe one of the groups this time. Let's see how it goes. Could I ask the group that included John, sorry, I'm not sure how to pronounce your surname, Owo, if there's someone who can give some feedback from that group?
Hello, can you hear me?
Okay.
Yes, we hear you well, John. Please proceed.
We didn't realize we were back to the main room. We were still chatting away. So
Sorry.
I will share some of the things we discussed, and my group members can jump in because we didn't quite get to conclude. So we looked at the studies one by one and tried to assess their relevance. And I think we agree that all of them have some degree of relevance to the question of interest. However, we picked some comments on study 6. It doesn't look at all parents, or it doesn't report that it considered all parents, because it talks about just mothers and, no, sorry, that was study 3 that talked about mothers, and it's assumed here that the other parents may also be caregivers, so their perspectives are left out. And then for study 6, the condition of interest was not uniform. There were other conditions, at least according to what we could see. So we mentioned those. And then we also looked at overall what is a good sample size to create relevance. And then we somehow concluded that given that they're qualitative studies, probably the sample sizes are not a big issue. And we were just trying to think on whether we would have some moderate concerns on overall relevance of these studies, given that they are all from high-income countries. So we think generally there is relevance. The findings could be applicable to other settings, but we thought that there could be some moderate concern about relevance to many other contexts that the guidelines may inform. And so that's where our discussion ended. So I would just pause there and invite my colleagues to chip in, because we didn't quite close up that conversation. So over to my group members.
Thanks, John. Would anyone like to add?
Thank you, John. Yeah, the concern about the that some study settings included children which were not suffering from FASD, but from similar related diseases was also raised.
Thanks, Mohammed. That's very helpful. So, I mean, you've picked up on several important aspects here. I mean, I was saying, I wonder if it was to your group or the other group, that all of these studies have been included in the review, so they're relevant to some extent. And what we're trying to explore here is if there are any important concerns with regard to relevance. And I think you've picked up on the fact that they were all done in high-income countries, and of course, there's a judgment involved, and this will vary. Whether that's important will vary according to the finding and the question you're asking in the review more broadly. And it's also where it becomes really helpful to have a content expert involved in the review, of course. And I'm not a content expert on FASD. But you might, for example, hypothesize that in low and middle income countries, it might be similar in terms of these problems with knowledge and understanding among healthcare providers, or perhaps in some settings worse if healthcare providers have poorer access to health information, or are less likely to encounter children with these kinds of conditions. So that might be an important thing to take into account. And then, of course, the range of types of or related conditions might be something you would want to explore. So those are all important issues. I think what's positive in this set of studies is that you do have quite a wide range of caregivers. We have parents, foster parents, so both birth and foster parents, and some other kinds of caregivers as well. So where we see consistency across, or where the reported experiences are consistent across the whole range of caregivers, that's a positive sign, something we wouldn't that would make us more we wouldn't have concerns necessarily we're missing a group of stakeholders here. So I'll stop there. Were there any more questions? We won't take full feedback from the other group, but are there any questions that the other group wanted to raise? Okay, then I'm going to hand over to Claire, who will take us through the next component.
Thank you, Simon. Just a moment, I can just find my slides. Okay, can people see my slides? Okay. Okay, so I'm going to talk about the second component, methodological limitations, and in the interest of time, we won't have time to do an exercise for this, and I see we're a little bit behind time, so we may also have to keep questions short. But we thought it was good that we went through every component, even if we don't have an exercise for every component. So this is the issue of methodological limitations that I referred to earlier on. So in the context of GRADE CERQual, we define methodological limitations as the extent to which there are concerns about the design or conduct of the primary studies that contributed evidence to a review finding. And, oops, sorry. So we'd be less confident that a review finding reflects the phenomenon of interest when the primary studies underlying a review finding are shown to have problems in the way they were designed or the way they were conducted. And Simon mentioned earlier that we don't have any widespread agreement about the best tool. So I think we're about 10 years behind, or maybe even 20 years behind, where reviews of effectiveness are, where there is a general agreement on one or two risk of bias tools. We don't have such an agreement for qualitative research, and we are working on that. We have a project underway called the Camelot Project, and we hope to come up with a sort of final tool, but at the moment there isn't a general critical appraisal tool that we would agree on. Some rules of thumb when selecting. Sorry?
I realized that we were supposed to actually have the break now. I forgot.
Oh, yes, sorry. Simon's just pointed out that we've completely forgotten the coffee break, which is obviously crucial. So,
do you think we should just finish this and then take the 10-minute break?
Yes, okay, so I'll finish these slides and then we'll take the 10-minute break. I hope you hang in there a bit longer. I won't be long. So when selecting a critical appraisal tool, and we know there are, literally hundreds of them out there, find a tool that you're familiar with. We tend to use one that's adapted from the CASP tool, for those of you who are familiar with that. Make sure the tool doesn't overlap with other components of GRADE CERQual. For instance, some tools ask questions about data adequacy, so then you'd be, in reality, sort of double counting. And make sure the tool focuses on the appropriateness of the methods used rather than whether the methods were reported. So a lot of these types of tools, they ask things like, did the studies describe how they did X, Y, and Z? For instance, did the study describe how they selected participants? And that's simply just a reporting tool. It doesn't actually say whether the tool was, whether the study did this well. So rather than that kind of question, what you should be looking for are tools that ask, were the methods used, for instance, to select participants appropriate? So not just whether they reported things, but whether the decisions they made were actually appropriate. So in the example we've given you in the worksheet, we've used the following criteria to assess methodological limitations. Is the participant sampling method appropriate? Is the method of data collection appropriate? Is the method of data analysis appropriate? Is there an appropriate description of researcher reflexivity? So that would be a discussion around the perspectives the researchers are bringing to the study. And was ethics approval granted? And this is by no means sort of, the ultimate checklist. This is something these are questions that are commonly used, and those are the ones we've been using in the worksheet. But regardless of which tool you use, there are some general rules of thumb. So first of all, you should always categorize your concerns about methodological limitations as either no or very minor, moderate, or serious, regardless of which tool you're using, so that it fits in with the rest of the GRADE CERQual tool. And you should always provide a justification for your assessment so that the end user can see what it was about the way the study was designed or conducted that you had concerns about. Again, remember that you're not trying to prove that the studies are absolutely perfect. You're assuming they're perfect until the opposite has been proven. You're looking for problems that are serious enough to warn people about. So you're not trying to prove that every study is done, according to some gold standard. Another rule of thumb is that the seriousness of the limitation depends on the relative contribution of the study that's weak to the review finding. So for instance, if you have 6 studies and only one of them is weak, this would be more concern. This would be, less concern than if, 3, 4, 5 of the studies had methodological limitations. So think about that. Think about the relative contribution of the weak study to the finding. And then another important issue, and I think this goes for every component in GRADE CERQual, the same methodological limitations can mean different things for different findings. So there isn't sort of an automatic downgrading when you see certain types of methodological limitations. So as an example, let's imagine a review of qualitative evidence synthesis that explored healthcare workers' views and experiences about the reporting of medical errors. So in this particular review, we might have concerns about the appropriateness of the way data was collected, because the data in some studies were collected through focus groups, and we might be concerned that discussions around medical errors might be held back by the fact that people didn't want to talk about this openly in focus groups. And we might assess this particular concern as a serious concern if the finding in the review described healthcare workers describing their own medical errors. We might say that, okay, this finding describes that particular topic, but we're not sure that these were the most appropriate methods to look into that. But we might think this was actually only a minor concern if the finding was describing healthcare workers' descriptions of their awareness of reporting routines for medical errors. So basically, if the finding, so the issue around the appropriateness of focus group methodology might have a much bigger impact on some findings than on other findings. So we're not going to do an exercise for the FASD example. So we're just going to very quickly go through what we concluded ourselves when we did this exercise. In this finding, we had minor concerns, and this was because of a lack of researcher reflexivity. So none of the researchers in the studies discussed what their perspectives were coming into the study, or how these perspectives might have influenced their study. But we do know from other parts of the studies that one of the studies was conducted by healthcare professionals working with FASD. So they may have, some sort of well, not exactly axe to grind, but they are definitely coming into the study thinking about how they themselves are perceived by parents. We know that one of the studies was funded by an FASD advocacy association. They might have particular interests in certain results coming forward. And we know that one of the studies was commissioned by a foster parent association, and they might also have a certain agenda. But as none of the study authors discussed how these type of situations were addressed in the study, we just don't know if that actually affected the study data. So because of this, we decided we had minor concerns. Other people might say that they had moderate concerns, but that was our conclusion. So minor concerns about the methodological limitations because of a lack of researcher reflexivity.
And now?
Yeah, it's okay now.
Good.
Please proceed.
Perfect.
Thank you.
Okay, so we're going to talk about this is now the third component we're discussing, coherence. And as we were saying earlier, the coherence component focuses on how clear the fit is between the data from the primary studies and the review finding. And you'll remember that sometimes the review finding is a sort of reflects everything that's in the underlying data, and in that circumstance, we wouldn't have any concerns. But we may, in some cases, choose to stress or emphasize some aspects of the data, but we may want to point that out to the user. And in other circumstances, we may create a model or a theory which makes a whole sort of set of assumptions about the relationships between these different pieces of data. And again, there we might have some concerns if we, for example, have if there could be a plausible alternative theory or model. So just to explain this a little bit more, on the left-hand side of your screen, you'll see a series of sort of light orangey colored dots. If you imagine those, or circles, if you imagine those to be findings from individual studies, you could simply describe what those studies are saying. The crudest way of doing that would be to say one study showed this, another two studies showed that, a third one showed the following. And if you did that, we wouldn't have any concerns about coherence because everything is captured. But you can imagine that that may not be the most useful way of doing it. We won't be looking for patterns. And we sometimes talk about this as a sort of form of, as a transformation of the data. And so on the far side, the right-hand side, with the darker circle, that's representing transformed data. And the more we sort of transform the data, the more we have to think about, are there any potential concerns about coherence? And another way of thinking about it is we may have on the left where we have a more descriptive kind of finding of the kind, as I was describing a minute ago, or to what extent do we have a more interpretive kind of finding here where we've taken the data further in some way. Now, just to give you an example of this, this is from another review, and this review focused on children who are living in residential institutions. So these are children who've, for one reason or another, had to be removed from their parental home, and they're in an institution now. And the commissioners of this review were interested in how these children experience different kinds of staffing patterns, particularly whether they prefer to have staff there in very long shifts. So, for example, staff rotating 1 week at a time, or shorter shifts, more like a hospital where you have, for instance, 8 or 12-hour shifts. And they found 5 studies that explored this issue. And in 3 studies, all of the children preferred week-long shifts rather than day-long shifts because they liked the family environment that this helped to create. In one study, children described poor relationships with one staff member and said they preferred short shifts. And I think the other study, which I now can't see.
The children's view is unclear.
Yes, the children's view was unclear. Sorry, my banner is just right on top of that. So you can imagine you could write a finding that looks a bit like the one on the screen now, which says most children preferred staff to have week-long shifts because they liked the family environment that this created. Children in one study preferred short shifts, but these children had poor relationships with one staff member. And in the one study, the children's views were unclear. So in this case, you wouldn't have any concerns about coherence. But if we look at the second option, you could write a finding that says where children have good relationships with staff, they are likely to prefer longer shifts because of the family-like environment that this helps to create. Now, what we've done here is we've really kind of made a connection or an association between the relationship with staff, the family environment, and the duration of the shift. So it's kind of putting together the pieces of the puzzle that are there and reshaping it into something more, a little bit more explanatory. Now here we might sort of say that we have minor concerns about coherence, because although this finding is broadly supported by the data that you saw, we did have the one study where the children's experiences were unclear, and there is one study where children preferred short shifts, but we've tried to take that into account by bringing in this issue of the relationship, the quality of the relationship with caregivers. So if you were writing this review finding, you might want to flag to the reader or the user that there may be some concerns here. So you have to think about which of these options you would prefer would be more useful to a decision maker. And what you could also say here is that the concerns that we have, we either have to account for them in the finding itself. So the option one, because everything is described there, we don't have to reflect those concerns to the user. But in the option two, a bit more explanatory, we have to then in the GRADE CERQual assessment assess that, reflect that transformation as a concern for the user. What we find is that when we start thinking about the coherence component, and indeed some of the other components, it may lead us to think about how we've written the findings. So you may think, oh, we've written this, quite a helpful interpretive finding, but hold on a minute. Have we taken into account all aspects of the data sufficiently, or why have we not sort of included this aspect? So we find we often then end up revising the finding a bit and coming back to these assessments once we've done that. So I'm going to stop there, and we'll have a chance now for an exercise. I think maybe we won't take questions yet now and take them in the group. What do you think, Claire? Should we do it that way, unless there are any questions in the chat? Okay. Great. So as we did last time, I'm going to divide you into a couple of groups, and we'll have a chance to go through this in the worksheet. So what we'd like you to do is very similar to before, choose someone to report back. And then we're looking at whether there's a clear fit between the data in table 1 and the review finding, and whether any concerns that you have are serious enough that you might they might lead you to reduce your confidence. And you can also think about, would you actually edit or rewrite that finding to address those coherence concerns? So just to remind you, we're looking at focusing on these data. It's the same table we looked at last time, but we're looking at this column of extracted data this time. So a reminder that you may have concerns regarding coherence, where you have contradictory data from the studies, where it's unclear if some of the underlying data support the review finding, and where there are alternative plausible explanations. Okay, so without excuse me, further ado, I'm going to break you up into groups. So yeah, so Hannah, Thomas, I think we're in that group. Kim, I can't remember, John, I think was also in that group. So any of you, just feel free to unmute and share some feedback from the group.
I can try.
Thanks, Kim. Please go ahead.
So what we mostly discussed is we went through the extracted data in the table 1, and I think our main conclusion was that most of the outcomes, they have a lot of things in common, and they have a lot of things that are overlapping. Some of them, they have part of the outcomes, like they don't all reflect on the full experience of the caregivers. Some have like an aspect of the experience of the caregivers, like the stress levels of the caregivers. But in general, they all seem to have like a similar pattern in what their outcomes are showing.
Thanks, Kim. That's very helpful. Is there anyone else from that group or from the other group who'd like to add or ask a question? Go on, John.
Hi, it's John here. I think Kim has sort of summarized most of our discussion. We concur that most of the findings, even though the themes reflected differently in some cases, as you explained, looking at the extracts, they all build around knowledge and understanding of the professionals and the challenges that the parents subsequently experience. So we didn't have any concerns with the findings.
Thanks to both of you from that group. Yes, I think you raised some good points. I mean, this is a quite descriptive finding. It doesn't make any really big claims. Perhaps I should put the finding back on the screen. It's not sort of creating really an explanation or an association. And I would agree with you that many of the findings would are a good fit with that. Many of the study findings are a good fit with that review finding. You could argue that there are findings from the studies or data from the studies that or some studies don't sort of capture the issue of both understanding and knowledge, that they're talking about knowledge in particular or understanding. And of course, not all of them address all the different kinds of service providers. But I think, in the round, there's reasonable support for that review finding, or a good match to that review finding from the extracted data. To make clear if there's anything else you want to add on this one.
No, I would agree with that.
So I hope you got a sense of how one starts to go about doing that. And you can imagine if you had a more explanatory finding where we are saying parents and caregivers experience a lack of understanding from service providers because, and then there might be some explanation. So, because they had prejudices against children who suffered this kind of, were born with these kinds of syndromes or disorders, or because they didn't think it was important. That would be a different kind of claim, and we'd have to look probably more sort of critically at the match between the data extracts and the finding that where we're making that broader claim. Good. So yes.
Yeah, and I can also add that when we do the coherence exercise, particularly, we do, because we're looking critically at the way we've structured our finding. It's very typical that we would edit our own finding to be a better match with the data. So this isn't sort of written in stone. We look at the data and then we think actually we should have been more precise or more nuanced, and so we would edit the finding as we carry out this the coherence assessment. So it's also very useful from that point of view.
Some people find that rather worrying that we go in and edit our findings, but it's part of the whole sort of thinking process. So in fact, the analysis hasn't really stopped when you apply GRADE CERQual. In a way, you can see it as an adjunct to the analysis that you've already done. So I'm going to stop there and hand back to Claire, who will take us through the last component.
Okay, I'll just find my slides. Okay. So can you see my slides okay? Okay, so I'm going to be talking about the fourth component, and then I'll briefly touch upon the overall assessment after that. So this is the fourth component, the data adequacy component, and you'll perhaps remember these slides where we discussed that issue. So in the context of GRADE CERQual, we define adequacy as the degree of richness of the data and the quantity of the data supporting a review finding. So we have these two different elements that we're focused upon. And we're less confident that a finding reflects the phenomenon of interest when the data underlying a review finding either are not sufficiently rich or only come from a small number of studies or participants. So what would make data not sufficiently rich or a small or too small a number? That's a judgment, and it would have to be made in the context of each specific review finding. So what is adequate depends on the finding. And we've created this sort of rule of thumb table, if you like, to help you think about that. And sort of broadly speaking, you could say that if you have a more descriptive review finding, so a more simplistic review finding as opposed to an explanatory review finding, you have less demands on the data richness. Whereas if you have a more explanatory review finding, which shows associations or links, you'd want more rich data that, properly explores and explains that kind of explanation. And similarly, if you have a review finding with a very specific or limited scope, you'd need fewer studies than if you have a review finding with a broader scope, where you'd actually want to have a greater amount of data. So the more ambitious the finding is, if you like, the more data and the more rich data you would want to see. So you may have concerns regarding data adequacy. Generally speaking, if the review finding is supported by data from only one or very few studies or participants or observations, that's usually a sign that almost regardless that, one study is rarely enough to feel confident in a finding. And just generally speaking, you need enough data for you to provide you sufficient detail to gain an understanding of the phenomenon. So if the data is very thin and you really actually aren't entirely sure what they're saying, then and whether your finding is grounded in the data, then you might have concerns. And again, we're not looking for perfection, we're looking for problems that are serious enough to warn people about. I thought I'd walk you through 3 examples to give you a sort of taste of what this might look like in practice. So this first example is from a qualitative evidence synthesis that looked at parents' views and experiences of communication about childhood vaccination. So one of the findings in this review was that parents generally found the amount of vaccination information they received to be inadequate. So parents were complaining that they weren't getting enough information. And this finding was based on 17 studies. And in these 17 studies, we were looking at pretty superficial data. It was often merely just parents saying, we didn't get enough information. There wasn't a lot of sort of thick description. They were just sort of stating that the information was not enough. But because this finding is a pretty simple, primarily descriptive finding, it's not making a massive claim about some sort of association or connection. It's basically just saying parents don't get enough information. We decided that we had no or very minor concerns about data adequacy. We had quite a lot of studies, and even if the data was thin, it was sufficient. It was sufficient to support this finding. So that's an example of a sort of not very ambitious finding, if you like. Although it was ambitious in the sense that it was talking about parents globally, we had 17 studies, but it was a descriptive, simple finding, so we didn't need particularly thick data. This is a second example, a slightly different type of finding. So this was a finding from a qualitative evidence synthesis that looked at factors affecting the implementation of lay health worker programs. And this finding says, program recipients were generally very positive to lay health workers. Reasons for this included the respect, kindness, and concern shown by lay health workers and their non-dogmatic approach. Recipients also appreciated the similarities they saw between themselves and the lay health workers, either because they came from the same community or because they shared similar social backgrounds. So here we have a bit more of a sophisticated finding. We're not just saying that people liked lay health workers, we're actually saying they like them because of this factor and this factor and this factor. So we're making a more of it's more sort of down the road of explanatory findings. It's not purely descriptive, it's also coming up with an explanation. So this was more complex and explanatory than the previous one. Yeah. This one was based on 25 studies. And 10 studies described how recipients were generally positive to the lay health workers, but they actually offered quite superficial or little information about the factors that appeared to influence these attitudes. So 10 of them were basically saying, yes, we like lay health workers, but not really a lot about why. But 9 of the studies were giving much more detailed and specific information about why. So we had a bit of a mix. And here we decided that we had minor concerns about data adequacy. So it wasn't a big issue, but we still had 9 studies that actually pointed to this connection between the fact that they like the lay health workers and the reasons why. So we decided we'd land on minor concerns here. Here's a third and final example. So this was from a review we did on health workers' views and experiences about how to communicate with older adults about vaccines. And one of the findings was as follows. Not all healthcare workers were convinced of the usefulness of vaccines for older adults. And some general practitioners suggested that in some cases, it might be more merciful to let weaker older adults die of diseases such as influenza or pneumonia. So this was an explanatory statement. It's saying that they didn't particularly see vaccines as useful, and it's explaining why they didn't see them as particularly useful. But it's also quite a shocking statement. They're actually claiming that it's better to let people die. So that's something which is quite a shocking claim, and we would want quite a lot of data to support that claim. We wouldn't want to go out and say we're confident that this is how all general practitioners feel. We really would like a lot of data to support that before we were to say anything like that. But this was based on 1 study only, and we thought it was an important enough finding to include, but it was also a finding where we wanted to highlight the limitations. So there we pointed out that we had serious concerns, and that was primarily because it was only based on 1 study. So an important issue to look out for, that general practitioners might feel this way, but certainly not something that we would feel confident is a sort of reasonable representation of how general practitioners feel around the world. So that was some examples, and then back to our own example. How did we assess the data adequacy for our finding about FASD? So here we had no or very minor concerns. And the reason for this was that this was a relatively simple descriptive finding, and we felt that we didn't have any particular concerns about the number of studies, and we felt that the richness of data was also sufficient to support the findings. So we didn't have concerns about the richness of the data for this particular finding. So that was that for adequacy. Any questions or comments about adequacy before I move on to overall assessments?
It's nothing in the chat.
Okay.
Please feel free to either unmute or put your question in the chat.
Oops, and I realize that I have to, just a moment, I just have to dig up the other slides. So I'll give you a moment to think about that while I find the other slides. I thought I'd open them, but they are shut again.
And you're also welcome to raise any questions you have about the other components that you've been thinking about.
Right, so in a minute, I hope these slides will agree to be opened. So we've done the 4 components, and there, right, just a minute. Okay, so can people see my slides?
There we go.
Okay, so we've now carried out the 4 assessments. So now we want to make an overall assessment, taking into account our assessment of all of these 4 components. And as I said earlier, we then have to end up on either high confidence, where it is highly likely that the review finding is a reasonable representation of the phenomenon of interest, or moderate, it is likely that the review finding is a reasonable representation, or low, it is possible that the review finding is a reasonable representation, and all the way down to very low, it is not clear, we do not know whether the review finding is a reasonable representation. So we would start with having high confidence in a review finding, and then we would at least rate down by at least one level for each component for which you have identified serious concerns. Now, you may not have identified serious concerns for any of the components, but if you have a sort of mix of, you may have some minor, some moderate, so you want to sort of lump those together and then consider how far down to downgrade your confidence, if at all. Oops, sorry. Yeah. So the process of doing this, it definitely benefits from discussion within the team. This is not something one should do alone, and you should try and do this consistently so that you're being equally strict for all of your findings. It's definitely a judgment. You need to be transparent and explain your assessment. And as I said, you also need to be systematic, that you're treating all of your findings roughly in the same way. The GRADE CERQual approach gives equal weight to each component. A lot of people ask about that. So we treat methodological limitations, coherence, adequacy, etc., with the same weight. And occasionally we find that there is some overlap across the components. So make sure you're not double downgrading, you're not punishing something twice. So to look at our overall assessment of the confidence in the finding we've been looking at for FASD. This is our assessment. It might not be the same as your assessment. So for methodological limitations, we concluded, if you remember, that we had minor concerns because of a lack of researcher reflexivity. So this was our concerns about the fact that we weren't entirely sure who these researchers were. We knew some of them had particular types of funding, or one of the studies was commissioned by a particular group, and we weren't sure what that meant for the study design and conduct. So we concluded that we had minor concerns. For relevance, we ended up concluding the following. We had minor concerns. We said that the studies are from 5 different countries and are likely to cover a variation in attitudes to and experiences of alcohol and FASD, so that's good. We pointed out, as several of you pointed out, that the studies are mainly from high-income countries, although we assume that studies from low-income countries where professionals are likely to have less education and thereby less knowledge of FASD would show similar findings, so we weren't too concerned about that. And then we pointed out that none of the studies are from countries with low alcohol consumption, but we assume that studies from these countries would show similar findings. So we were saying that there was definitely a focus on high-income countries, but we are assuming, we're speculating that other settings would show the similar or perhaps even stronger data along the same lines. So we ended up sort of compromising by saying that we have minor concerns. For coherence, we had no very minor concerns. We felt, as several of you felt, that the data was it was reasonably similar. There was a reasonable fit between the finding and the underlying data. And for data adequacy, we also had no very minor concerns. We felt for this relatively simple descriptive finding, the data was sufficient. So we took these 2 minors, and then we ended up saying that we had moderate confidence in the finding. So that's how we rated that finding. Other groups might have been slightly stricter or slightly less strict, but this is more or less, I think, what most people would come up with, and we are being transparent about why we did this. So that's that for overall assessments. How are we doing for time?
We have a couple more minutes for questions before we hand over to Arash, I think, for the last part of today's workshop.
So I'll just very, very quickly finish the last slide. So we tend to put findings from qualitative evidence synthesis and GRADE CERQual assessments in summary of qualitative findings tables. Those of you who are familiar with GRADE for effectiveness are familiar with these kinds of tables. It's very similar. We have the review finding, we have the CERQual assessment, we have the explanation of the CERQual assessment, and then we have the studies contributing to the review findings. So we tend to present this as part of the review, and then we also have a more detailed evidence profile which unpacks the CERQual assessment. Yeah, so I think I perhaps won't go into this in great detail, but I see there's a, oops, and now my, no, my battery is about to die.
It's not a question.
It's not a question. Okay, sorry, I just need to plug in here. So to summarize, we've looked at the GRADE CERQual approach, we've looked at the overall assessments. Again, if you'd like to watch this session or basically all of the issues we've discussed here, we have presented in a series of videos, and I've put that at the very top of the chat. So if you scroll up to the top of the chat, you'll see a link where we have a number of resources that include all of the topics we've discussed today. We also have a few other resources you might want to look at. One of them is ISOC, which is the interactive version of so it's an interactive tool which you can use to carry out your GRADE CERQual assessment.
Maybe just to add one thing there, that on ISOC, that it's free to use and you're welcome to go and explore. It includes an introductory video under help, and that will give you an overview of what you can do on the platform. But we find it really helpful for people. It takes you through all the steps of the GRADE CERQual approach, and so it's very helpful when you're doing that assessment.
Thanks, Simon. And it's a relatively new tool. We're still improving it. So any frustrations you have or experiences you have, please let us know about it. There is a function there where you can contact the support team. We'd invite you to join the mailing list. Please join the mailing list or the project group. Follow us on Twitter. We have a series of papers in implementation science, but you're probably best off starting with the videos. Yeah, we also offer free question and answer webinars about every 6 weeks. So if you are carrying out a qualitative evidence synthesis and you have experiences and frustrations, or you're stuck in some way, please join the webinar and ask your questions. And you can register for them on our website. And finally, we also have a template for the Cochrane qualitative evidence synthesis, which is freely available as well and can be used on any qualitative evidence synthesis. So you'll find the link there, and we'll share these slides afterwards. So I'll stop there so that's the time for any final questions before I hand over to Arash. Any questions or comments?
Chat, right.
Okay, then I think I'll hand over to you, Arash, for the final words.
Thank you, Claire and Simon, for, as always, excellent presentation. Before I say a few words, Mehnaz, do you want to say something?
Thank you, Dr. Arash. I just wanted to thank Claire and Simon for the great presentation, and also for participants for the interactive kind of discussions and cooperation in this meeting. I also just wanted to mention again that the resources that just shared by Claire in her final presentation, they are all you can find the Word file, which is put on the chat box. And also there is a link which is shared at the beginning of the session by Claire. So all these resources also are accessible through that link as well. Thank you, Dr. Arash. Over to you.
Okay, many thanks. I'm extremely grateful, Simon and Claire, for your time and for the provision of the workshop. This is absolutely important. Obviously, I mean, this is an area that is not very common use in our region, in countries of the region. So, I mean, in terms of how to use qualitative evidence synthesis in decision making, although there are researcher groups that are using the approach and the CERQual methodology for their analysis, but when it comes to using that in actual decision making, it's not, I mean, guideline panel, etc. It's not that common yet. So for us was a purposeful initiative as part of the workshop series that the Evidence and Data to Policy team is organizing and hosting to make sure that this is also included. And we hope, I mean, these opportunities allow for further use of qualitative evidence, and in a way also systematizing the way that we use evidence from qualitative data in decision making. So for that, I mean, a strategic approach, but also, I mean, I acknowledge the time that both of you put on this. I know this is a workshop you've done many times, but still, I'm really appreciative, especially, I mean, both of you were in Geneva just last week for supporting WHO guideline review committee. And so after a long trip, so that's very appreciated. So my main issue is that perhaps, I mean, on the what to do next and processes. First of all, I mean, just a few, I'm sure Mehnaz has mentioned those. I mean, she mentioned those at the start of the session. So this is a part of the capacity building events targeted at the institutional members of the Net2P, but we also open it to everyone who has interest to join. All the resources, including this session, is recorded. I mean, colleagues, after, with a time lag of, I mean, I would say a few weeks, it will be uploaded to the repository that we have. So it will be one of the resources that people will be able to refer to. But for us, the main issue is that sort of to use this as part of the longer term program that we go forward. If I want to say a few words, and unfortunately, I wasn't able to listen to the starting presentation by you, Simon, but if I recall correctly, always you have a starting presentation that you categorize the type of policymakers' questions in which qualitative evidence can be used for answering that. So for us, the main issue becomes that how to ensure answering those questions follows a systematic approach. I mean, when we talk about whether an intervention or a recommendation is doable, whether it's feasible, what would be the reaction of the sort of the main stakeholder? What would be the reaction of the users? What would be the reaction of those who receive the services? These are the questions that always decision makers ask. And usually those who are involved in decision making, they actually give answers to those. Some of those answers are mentioned loudly. So saying, oh, we know our patients don't like this, or we know that this will be possible, or it doesn't work in our country, or it works in another city, but not in our city. So those answers are always given in the interpretation of evidence, in the sort of applicability of the evidence, in also whether sort of, I mean, certain issues that the qualitative evidence can help us to actually answer the direct question. With the approach using the sort of evidence, qualitative evidence synthesis, and then also assessing the confidence on those syntheses is a way of systematizing that, similar to what we do when we talk about evidence of effect. When we say drug A is better than drug B in, for example, reducing hypertension or averting premature death among diabetes patients. So then the issue becomes, what is the acceptability of the medicine? And for that, I mean, qualitative evidence is the main source. And that's not the only category of questions, of course. I'm not repeating what you both of you have said beautifully with several examples in several guidelines, etc. So how to take this within that context is, for us, is important. So I mean, obviously this capacity building is a generic one for the sort of making sure that happens, but for us would be to bring it into the guideline programs and also the discussion within other evidence to policy approaches. And that's what my colleague Mehnaz and her team are doing. So I mean, in the process of the support for national guideline programs in the region, as well as other areas of evidence to policy. So probably I spoke more than I had been allotted in terms of time allocation, and we are 2 minutes to end. So a pleasure, and great thanks to you, and great thanks to colleagues who are with us on the call. And I look forward for further opportunities that we work with both of you, Claire and Simon. And especially, I don't know, Mehnat, whether you mentioned that or not. So, and both of you are from institutions that are among support institutions for Net2P. In a way, that's also within that category of support for the region. Thank you also. Mehnat, back to you.
Thank you so much, Dr. Arash, for the closing remarks.
Thank
Thank you, everyone. Thank you for being with us, and thank you, Claire, Simon, again for the great, technical discussions and sessions. Thank you so much. We hope that we will see you again in our future workshops in 2024. Thank you.